Hi, my name is Charlene Pulaski. I'm a psychiatric nurse practitioner. If you are a psychiatric mental health provider, or you know someone who is, or if you're about to graduate as one, and I want to tell you congratulations if you're about to graduate as one, I remember that all too well. I want to tell you about my company. It's Clinical Logi RX. It's thorough treatment with logical application. And it was developed because I have had the honor to precept many students, and they have shared with me where they feel they needed extra support. And because of that, I have taken the time to develop three areas, three courses. And so those three courses look like key resources, key concepts that is going to help support that it would be help with maybe websites that would look at maybe a special population. If some special population was trying to conceive, what medications would be appropriate to prescribe or not, looking at scales, looking at time management, looking at how to handle when we are requested of us ESA letters or FMLA letters, how to handle those situations. So that is one course. Another course would be diagnosing. And of course, that encapsulates a great deal, a great deal. It looks on how to identify if the patient actually meets the criteria of the DSM criteria for a diagnosis. Why it's important to consider the differential diagnoses, right? And how asking one question or multiple questions can change that initial diagnosis that you were thinking. So, those are some things that we could be talking about in that course of diagnosing. The other one is meds, and that's a little bit of a longer course. In that course, we look at prescription medications, the most commonly prescribed meds that we use in our field, the non prescription medications, because we do have to take into consideration not everybody wants prescription medications these days. So we have to be respectful of that and know what our non prescription medications we can use to help treat those symptoms that the patient is experiencing. So we talk about that as well. And then the basics of prescribing that we share with the patient, right? Such as how to take the medication. And then we also talk about questions to ask about those meds when the patient comes back in to know if the medications are working. So that's just a little snippet. There is a whole lot more, but I just wanted to share with you some basics about what Clinical Logi RX has to offer. I would love to offer my tools to you to support you to better equip you so that you can be more confident and you have the resources and the tools to help you unlock what's already within you as you go forward and start to go on your own as a provider. So if you're interested, please do pop on over to Clinical Logi RX, and I look forward to seeing you, and I would love to be able to support you. Thank you so much.